If you have osteoarthritis, what sort of medical doctor should you see for your condition? Hello, this is Dr. Siddharth Damber, specialist in rheumatology and regenerative medicine, discussing with you all your musculoskeletal issues. So if you've got osteoarthritis, there's quite a few different people that you can actually see in the healthcare system. When it comes to medical doctors, there's a few specific specialties, and let's go over the difference between these different specialties and also who you should ideally see. So within the different specialties, first and foremost is rheumatologists. Rheumatologists are focused on inflammatory arthritis, things like rheumatoid arthritis and psoriatic arthritis. They also treat osteoarthritis, and they're generally utilizing injections like steroid injections and gel injections. Next, you've got orthopedic surgeons. Orthopedic surgeons are great if you need surgery. That's their focus, that's their specialization. For non-surgical treatment, in an orthopedic surgery office, you're generally going to be seeing their physician assistant rather than being treated by the actual physician. Orthopedic surgeons are great at surgery. Their entire system is based on treating you around a surgical model. If you want a non-surgical treatment option, I would recommend seeing a physician who's specializing in non-surgical aspects of your musculoskeletal health. So next are physiatrists or sports medicine. They generally are focused on younger patients and sports injuries. They focus a lot on rehabilitation. They'll also utilize a lot of traditional injections like steroid injections and gel injections. Then you've got interventional pain doctors. These are folks who are very focused on image-guided injections, using traditional injections like steroid injections. They also do a lot of radiofrequency ablation where they burn off the nerve. They're also very focused on the spine. So you have a few different options to see when it comes to your musculoskeletal health. Who should you ideally see if you've got osteoarthritis? So if you need surgery, you go see an orthopedic surgeon. But if you're not sure if you need surgery, if you're looking to avoid surgery, then number one, you should be seeing a non-surgical musculoskeletal expert. That means one of these other fields, either rheumatologist, physiatrist, sports medicine doc, or interventional pain doc. Next, if you need an injection option, you should be seeing someone who has expertise and is a specialist in image-guided injections. That means utilizing ultrasound or X-ray guidance. Now, realistically, any of those specialties can utilize image guidance. It's just a matter of, did they bother to get the training and the expertise to do that? And then lastly, osteoarthritis is all about instability. And that means that the supportive tissue around the joint has gotten weakened over time and is now leading to more stress on the joint. The best way to treat instability is by strengthening the overall tissues around the joint and utilizing regenerative medicine. Regenerative medicine is the process of utilizing your own cells, such as your own blood platelets or bone marrow stem cells, injecting them not only to the joint or the tendon that's damaged, but also treating the supportive soft tissue structures and ligaments around the joint to make an overall stronger joint to give you more pain relief and better function. That is preferable and a better option than utilizing steroid injections, gel injections, or radiofrequency ablation. So your physician should be an expert in regenerative medicine if you've got osteoarthritis and if you're looking to avoid surgery. So your physician should understand concepts like prolotherapy, which is injecting your cells into those soft tissues to make the joint stronger. And they should also understand the difference between when to use prolotherapy, when to utilize platelet-rich plasma, and when to use your own bone marrow stem cells. They should be an expert in orthobiologics, the cells that you actually use to treat your osteoarthritis. So you have a lot of different options. Ideally, you should find someone who's a musculoskeletal expert, non-surgical expert, image-guided specialist, and an expert in regenerative medicine. If you found this content to be helpful, give us a like, subscribe to the channel, and until we connect again, have a good day and live well. Bye-bye.